COVID-19 is continuing to spread around the world, with around 235 million confirmed cases and more than 4.8 million deaths across almost 200 countries. The US, India and Brazil have seen the highest number of confirmed cases, followed by the UK, Russia and Turkey. Very few places have been left untouched. In the table below, countries can be reordered by deaths, death rate and total cases. In the colored bars on the right-hand side, countries in which cases have risen to more than 10,000 per day are those with black bars on the relevant date. Note, the map, table and animated bar chart in this page use a different source for figures for France and the UK from that used by Johns Hopkins University. US figures do not include Puerto Rico, Guam or the US Virgin Islands. The 100 millionth COVID case was recorded at the end of January, about a year after the first officially diagnosed case of the virus. The true extent of the first outbreak in 2020 is unclear because testing was not then widely available. Deaths are rising in some areas, however official figures may not fully reflect the true number in many countries.
Data on excess deaths, a measure of how many more people are dying than would be expected based on the previous few years, may give a better indication of the actual numbers in many cases. Of the 196 countries and territories administering vaccines and publishing rollout data, 67 are high-income nations, 103 are middle-income and 26 low-income. The map below, using figures collated by Our World in Data, a collaboration between Oxford University and an educational charity, shows the total number of doses given per 100 people, mostly first doses. Overall, China and India have administered the highest number of doses, with about 2.2 billion and 906 million respectively. The US ranks third, with more than 395 million. But when breaking the figures down by doses per 100 people in countries with a population of at least 1 million, the United Arab Emirates, Cuba and Uruguay top the list. Most countries are prioritizing the over 60s, health workers and people who are clinically vulnerable. Some countries have secured more vaccine doses than their populations need, while other lower-income countries are relying on a global plan known as COVAX, which is seeking to ensure everyone in the world has access to a vaccine. The number of daily cases is stable or falling in every region. Asia, which was the center of the initial outbreak that spread from Wuhan in China in early 2020, has seen cases falling in recent weeks. Singapore, however, has seen a sharp rise in daily cases. In India, where the number of new daily cases has fallen recently, the official death toll is more than 448,000 and it has recorded more than 33 million cases, second only to the US. Latin America. In Latin America, Brazil has recorded more than 21 million cases and almost 600,000 deaths, the world's second highest official death toll. Mexico has seen the fourth highest number of deaths in the world, with more than 277,000, and after another surge in cases, numbers are starting to fall again. There have been nearly 200,000 deaths in Peru, which has seen the highest number of deaths by population size, about 600 deaths for every 100,000 people. Europe. Several European countries have seen a rise in cases recently, driven by the Delta variant of the virus, including the UK, Russia and Romania. In the UK, the high level of vaccination has greatly reduced the number of hospitalizations and deaths. North America. The US has recorded more than 43 million cases and over 700,000 deaths, the highest figures in the world. The death rate in Canada is far lower than its neighbors, but it is currently seeing a rise in the number of daily cases. Middle East. Several countries in the Middle East have seen severe outbreaks of the virus. The official death toll in Iran, the Middle East's worst-hit country, has passed 120,000, but confirmed case numbers are now falling. Israel has rolled out a highly successful vaccination program. Cases are now falling after a recent spike in numbers. Africa has seen more than 8 million cases and more than 200,000 deaths, but the true extent of the pandemic in many African countries is not known as testing rates are low. South Africa, with 2.9 million cases and more than 87,000 deaths, is the worst affected country on the continent, according to official figures. Morocco has recorded around 935,000 cases and Tunisia is not far behind with more than 700,000. Oceania, Australia and New Zealand have been praised for their response to the pandemic, with both countries having seen comparatively few deaths. Australia has announced that it is to reopen its international border from November, restoring the freedom to travel to vaccinated citizens and relatives. New Zealand has also been in lockdown since mid-August, though it is recording around 20 cases per day. COVID-19 was first detected in the city of Wuhan, China, in late 2019, but the outbreak spread quickly across the globe in the first months of 2020. It was declared a global pandemic by the WHO on the 11th of March, 2020. A pandemic is when an infectious disease is passing easily from person to person in many parts of the world at the same time. The data used on this page comes from a variety of sources. It includes figures collated by Johns Hopkins University, data from the European Centre for Disease Prevention and Control, national governments and health agencies, as well as UN data on populations. When comparing figures from different countries, it is important to bear in mind that not all governments are recording coronavirus cases and deaths in the same way. This makes like-for-like comparisons between countries difficult. Other factors to consider include different population sizes, the size of a country's elderly population, or whether a particular country has a large amount of its people living in densely populated areas. In addition, countries may be in different stages of the pandemic.
Thank you for watching. Please subscribe.